Hello, I'm back, and in this video lecture, we'll finish our discussion about TRICARE. TRICARE has a couple of different options. We have TRICARE Prime and TRICARE Select. We have also some other TRICARE health plans, for example, TRICARE for Life. And there are different supplemental health care programs that are offered by other insurance providers. TRICARE Prime is relatively new, and it is the managed care option. So in other words, we have a primary care manager, which is either a military or frequently a network provider who's assigned to provide care. The beneficiary receives care if they live and work outside a military treatment facility, a catchment area, and they're usually within 40 or 50 miles of a military base. There is a catastrophic cap benefit to prevent beneficiaries from being financially devastated due to a serious illness or injury. And they have limits over what payments are or are not required. TRICARE Select is a self-managed preferred provider network that's available. And the beneficiaries schedule an appointment with a TRICARE authorized provider, much like any other PPO. For some services, pre-authorization may be required. There may be additional costs such as enrollment fees, deductibles, and other patient or beneficiary cost sharing. And again, we have some of these other TRICARE health plans here, but again, all falling under the TRICARE umbrella. So what is the difference between TRICARE Prime and TRICARE Select? Comes down to three words: managed care option for TRICARE Prime. TRICARE Select is essentially the PPO option. And again, as we've seen with other insurers, we use the CMS 1500 form for professional services and the UB04 for facility services. We also have DD forms 2527 and 2642. If a patient has other health insurance and we want to use that along with TRICARE, we would use the form 2642. There are claim submission deadlines. Usually they're 1 year from the date of service for any outpatient care or inpatient hospitalization. Eligibility does need to be confirmed prior to admission or other services with TRICARE. TRICARE does have some limiting charges for non-participating providers of 15% above TRICARE fee schedules, and patients cannot be billed the difference between the provider's normal fee and the TRICARE limiting charge. And again, the 1500 form, as we've seen. And then when the patient has additional healthcare coverage, for instance, a Blue Cross Anthem, Blue Cross Blue Shield, or other coverage in addition to TRICARE, the participating providers submit just one claim. For any TRICARE and supplemental claims, the patient's primary health insurance would be TRICARE. The secondary insurance would then come in after. And that's all I have for you. We'll see you online. Bye now.